Bula Fiji. Today has not been an easy day, nor do I expect the days ahead to get any better. Today we had 46 new cases to report. They're all from the Central Division. 43 of these cases are linked to existing clusters that were under investigation and that have been detected through contact tracing and targeted screening. The cases are as follows. They had 28 from Nandali in Nosori, 3 were from Navosai and are linked to a Narere funeral cluster, 2 from Monikoso, 9 from the Navy cluster, of which 8 were in Kinoya and 1 is from Nandonima in Lami. We had 1 from the Savambula funeral cluster. 3 new cases are currently not linked to any of these other cases and are under investigation. The Nandali community is now on day 29 of lockdown, while Monikoso is on day 6. 2 patients have recovered, which means that we have now about 195 active cases. All the active cases are in the Suva containment zone. In other words, we have no more active cases out in the west at this point in time. 2 of our current active cases are being managed in the intensive care unit. So Fiji has had about 360 cases in total since our first case was reported on March 2020, with 161 recoveries and 4 deaths. There have been a very significant increase in the daily cases reported from the Suvanosori area. It is important to note that the majority of these cases were found as a result of our extensive contact tracing effort, and they actually are linked to clusters that we were investigating. So this increase was not unexpected at all, but it should serve to show us all how easily this virus is transmitted and why restrictions are in place. We expect the number of cases to actually rise because we are testing aggressively in many of the areas that we know that the virus is spreading. We also have a number of prominent locations that are under investigation, including Government House and Kandabu House. So once again, the public will see a lot of our team going around cordoning off various places. That's all part of the investigation. And this will become a more common sight as the number of cases begin to escalate. The virus is spreading within containment zones, so we will be exercising extra vigilance to ensure that there is no spread outside those containment zones by strengthening the enforcement of COVID-safe measures such as limitation on movements and gatherings, wearing of masks, physical distancing, and other measures designed to prevent people from coming into contact with the virus. Now, activities surrounding funerals appear to be the most troublesome spreader event at this moment. And this is an alarming situation. Everyone should recall that this latest outbreak gained momentum when one person who contracted the virus in the border quarantine area attended a funeral. The death of a loved one is a difficult time for everyone, but people must adjust to the current situation and avoid funeral gatherings. The deceased must be buried, and we must pay our respects and accompany them during our last hours with them. But we must temporarily find new ways to do this. Families are urged to limit graveside services to 10 persons and to limit gatherings before and after burial to 10 persons or less. Our investigations have indicated that in some instances, some of these funeral gatherings went up to 100 persons. And what was done was that they split up the 100 persons into 5 bubbles of 20 persons in one compound in order to appear to comply to the requirements of funeral gathering. Many of you will understand that this does not make sense. We need good sense in the common sense space. I've said that before. We need to stop twisting and turning our COVID-safe measures to suit our own personal agendas. We need to treasure the memory of those that we have lost. And when some semblance of normalcy is achieved, we can have memorial events in which our loved ones can be better commemorated. As regards to our vaccinations, since Monday we have administered 19,348 vaccinations in the Suva corridor and 24,042 in all of Fiji. To date, 18.5% of the targeted population have received at least one dose, and 3,117 individuals have had 2 doses. An additional 50,000 doses are due to arrive in the country by the end of the week. Once these doses are deployed, at least 260,000 Fijians will have got their first dose. I want to urge all Fijians to stay the course and follow the practices that are necessary to contain this outbreak and get us back to normalcy. We know that these lockdowns are disruptive for all of us, and they are unavoidable, precisely because they are the only way to stop this infection from spreading. Avoid social gatherings. Maintain a social distance of at least 2 meters when you are outside your home, and ensure your mask is worn properly. Wash your hands frequently with soap and water for about 20 seconds each time, and download the CAF Fiji app. Thank you.
Thank you and good evening. As just announced by the Permanent Secretary, there have been 46 new cases to report today. 43 of these cases are linked to existing clusters, and 3 are currently not linked to any other cases and are under investigation. 2 patients have recovered, which means there are now 195 active cases, and these are all within the Suva containment area. 2 of these active cases are in the intensive care unit at the CWM hospital. Fiji has now had 360 cases in total since we recorded our first case in March of 2020. And we've had 161 recoveries and 4 deaths. In terms of testing, over 58,000 COVID-19 laboratory tests have been conducted just during this outbreak that started in April. And in total, since we started testing in early 2020, we've tested 101,588 samples, not including the 11,000 samples that were recently tested in Melbourne, Australia. A total of 2,673 samples were tested yesterday, and our daily average of testing per day in the last 7 days has been 2,515 tests per day. At the national level, we're testing at an average of 2.8 tests per 1,000 per day. And our test positivity at the national level is 0.9%. The most recent data shows that 3.2 tests per 1,000 population are being conducted in the Central Division. This is above our target, which is 3 tests per 1,000 population. This is a level of testing that is comparable to both Australia and New Zealand during their recent outbreaks. However, the 7-day average daily test positivity in the Central Division is noted to be increasing and is currently at 1.1%. This is still below the 2 to 5% threshold that we have, but this upward trend also is indicative of the increasing number of cases reported daily in the Central Division despite high levels of testing. As mentioned earlier, the majority of these new cases reported from the Central Division are linked to existing clusters, and they're found through the extensive contact tracing efforts of our Central Division team. These clusters are large because they're associated with mass gathering events, in this case funerals, or there are cases that work in areas that are large work groups, or they came from very large households. So we are, again, as Dr. Fong has been reiterating, we are asking you, please don't attend mass gathering events. We've asked that funerals be reduced to a certain size. Please listen to our directives. Don't attend social events. If you get invited by someone after work to a work party or work function, please don't go. We've seen very clearly that it's these mass gatherings that are causing so many cases and are putting more and more strain on our teams in the divisions. The Central Division team, honestly, have been working almost 24/7 in all hours, all weather conditions, trying to trace these cases, and they've done a remarkable job. But there's only so much we can do. We really do need the public's help. Please listen to all of the directives and the advice that we're giving you. We're all in this together, and only if we work together will we get this under control. Thank you.
Bulavanaka, today is the 40th day of the current outbreak. The health response continues, and in particular, the mass screening and contact tracing for our positive cases. Our stationary clinics, our mobile clinics, as well as our targeted screening clinics and contact tracing continues in restricted in containment areas and in the red zones. In the last 24 hours, our 56 currently operational screening clinics saw a total of 3,523 individuals and swabbed 340 individuals, bringing the total of individuals or Fijians currently screened at our stationary clinics to 74,542 screened and 6,772 swabbed. We currently have 13 community and hospital isolation facilities active. 6 are community isolations and 7 health facilities acting as isolation wards, accommodating a total of 197 positive individuals. As you would have known, in the last few days, Lautoka Hospital gladfully completed their lockdown of 21 days, and the patients and staff have been discharged after completing 21 days and 4 rounds of testing with no positive cases. Lautoka Hospital over this weekend will start to take in inpatients from the FEMAT field hospital and is expected to resume normal function on Tuesday, the 1st of June 2021. However, the hospital's current pilot telehealth project on virtual SOP services will continue for the next 4 weeks. So patients who've accessed this hospital or will access this hospital over the next 4 weeks will be advised to contact the hospital and access the medicines at the Girmit Center in Lautoka. This is day 20 of the operations of the FEMAT field hospital. To date, some 1,338 individuals have gone through the triage services at the field hospital, and the field hospital has recorded 152 admissions and 93 discharges today. A total of 58 operations have been carried out, 19 at the field hospital and 39 at the MV Vevueti hospital ship. Currently, the FEMAT hospital is now supporting Lautoka Hospital. As I've stated earlier, will move patients over the weekend to Lautoka Hospital and remain on standby for the hospital over the next week before moving out of Lautoka on Sunday, 6th June 2021 to take up a supporting role for CWM Hospital. As stated earlier, our vaccination program is rolling out well and picking up pace. We're getting into the rhythm of the new way of providing vaccination services at the community under COVID safe measures, and we are inviting members of the public, again, get vaccinated when it is offered. It will protect you, your family, and the nation. We maintain our COVID-safe message for all Fijians. Wash your hands regularly, practice correct cough and sneeze etiquette, maintain social distancing, and stay at home if you don't have a good reason to move. If you're out of your home, wear a mask. This is important in particular for containment areas. To conclude, as stated earlier by PS, we are very concerned, the ministry is very concerned about the death rituals or the last rites we accord our deceased relatives, because they pull in and congregate very close relatives who are normally not part of our households, as well as bring in distant relatives who we meet infrequently, maybe once a year, and occasionally relatives that we've never met before. But they set the perfect stage for a super spreader event. They allow people to move, gather in large groups, break their family bubbles, and present excellent opportunities for the transmission of the virus. So the ministry is asking Fijians, all Fijians, for this time of the outbreak in Fiji, temporarily amend the way we conduct our last rites. It can be done without dishonoring our family members or our traditions. I know because I have made the change when a death occurred in my family last month. Although difficult, I suspended condolences. No rengu, no fourth night, no 10th night, and so on, to a later date. I'm still observing the 100 nights of mourning to pay my respects, but just my household. And my family understands. In doing this, I have saved my family from a deadly disease. We ask our traditional leaders, our religious leaders, community leaders, to lead the way, provide the guidance to members of our community. It is temporary, so we will revert to normal once we have gone past this outbreak. Vina walevu and good evening.